Just briefly wanted to go over the schedule here, the categories of controlled substances. They have been put in the following 5 categories, Schedule 1, 2, 3, 4, and 5, from highest potential for abuse to lowest abuse potential, and the ways that they are used, the types of means and ways that they might be put into practice or put into use. So we're just going to go over those categories now briefly, describing what types of drugs would be, or controlled substances would be in those categories, and then once again how they'd be used. So when we think about Schedule 1 in controlled substance categories, these are the drugs or the controlled substances that have the highest potential for abuse, and they are used mostly in research, and these are things like heroin, peyote, and marijuana. It doesn't mean that they have the highest potential for addiction, they just have the highest potential for abuse. So those controlled substances that have the highest potential for abuse are put into Schedule 1, and they are used medically primarily in research. Schedule 2 have a high potential for abuse, and they are used therapeutically, and these include opioids, amphetamines, and barbiturates. So these are prescribed in some ways, and they do have a high potential for abuse. Schedule 3 controlled substances have a mild to moderate physical dependence possibility or a strong psychological dependence possibility, or sometimes both. Physical and psychological dependence risk in Schedule 3. This would include opioids like codeine and hydrocodone that are often mixed with other non-opioid medications. So we've gone from the highest potential for abuse, used mostly in research, high potential for abuse used therapeutically, a mild to moderate physical dependence or strong psychological dependence, or both. And then Schedule 4 are those controlled substances that have limited potential for abuse or dependence. So limited potential for abuse or dependence is Schedule 4. These are benzodiazepines and low potency opioids. They're less likely to be abused and less likely for people to become either psychologically or physically dependent upon them. And then those controlled substances that are put into Schedule 5 have the lowest abuse potential, and these would include cough and antidiarrheal medications. So this is basically the breakdown of the various controlled substance categories, Schedule 1 through 5, from the highest potential for abuse to the lowest abuse potential. The types of substances that fall into those categories, starting with heroin, peyote, and marijuana, is the highest potential for abuse, all the way down to the lowest abuse potential of cough and antidiarrheal medications. And then everything in between in terms of high potential, limited potential, or those that have a mild to strong chance of causing physical or psychological dependence. If you'd like to learn more about these categories and things related to it, underneath this video you'll find a link. If you'll click on that link, it'll take you to that website. And while you're there, look for a link to an ebook that's ready for immediate download.